I was born 20 years ago. When I was a child, I was very ill in the hospital many times. In 6th grade, I was actually missing school more than I was at school. In high school, I was actually homebound for 2 years. During this entire time, I also had problems swallowing food. I ended up in the hospital choking many times. The doctors in the hospital eventually said that I need to take a test called a barium swallow. In this test, they discovered that I had a disease called Eosinophilic esophagitis. It's very important that they found this disease because they allowed them to treat the most common side effect, which is immune deficiency. Now that I'm under immunotherapy, I can now live in the world and be around people. So why did I just tell you this story? I told you this story because because eosinophilic disorders are a common and growing disorder. It's if you have allergies, food allergies, seasonal allergies, acid reflux, or asthma, you have a higher chance of having an eosinophilic disorder. So today I'm going to be talking about what eosinophilic disorder is, and two most common variations, which are eosinophilic esophagitis, which I'll refer to as EOE, and eosinophilic gastritis, which I'll refer to as EOG. If you're wondering why I have the knowledge to tell you guys about this, is because I live with EOEs, as I said, and I've done extensive research on EOG, so I both know EOE and EOG very well. But to understand what eosinophilic disorder really is, we need to understand what eosinophil is. Dr. Ruthenberg at the Children's Hospital of Cincinnati states that an eosinophil is a type of white blood cell which constitutes two main processes in your immune system. The first is to eliminate foreign substances, and the second is to encourage inflammation, which will control a disease site. Now, a small amount of eosinophils is normal, as you can see, but a large amount of eosinophils will cause a eosinophilic disorder. Eosinophilic disorders are relatively new to doctors. It's only been about 30 years since they discovered what an eosinophilic disorder is, which is a very small time when compared to other diseases. The Hospital of Philadelphia states that 30 years ago, EOE was unknown. EOE, when it was first being diagnosed, was thought to be very rare, but in the past 5 years, the diagnoses have risen dramatically. Now, they say that this could be because of two main reasons. Either because it's more common in people, or it's easier to detect in people. They say that it's probably a mixture of the two. So, you're probably wondering what causes an eosinophilic disorder. The cause of an eosinophilic disorder isn't really well known. The doctors at EOEresearch.org state that it seems to have a common trend in patients with a high amount of food allergies or seasonal allergies. They say that if you avoid the allergen, you will have a reduced effects in the disease as well. So now let's move on to the first main variation, which is eosinophilic esophagitis, or EOE. The signs and symptoms of EOE are, from Children's Hospital of Philadelphia, nausea, regurgitation, vomiting, abdominal pain, burning feeling similar to acid reflux, and they may have difficulty swallowing and gagging. If EOE goes untreated, then the esophagus may narrow because of scarring. This is called a stricture. And this here is the scarring that they're talking about. So it would get worse and scar worse than that. So EOE is treated with a main treatment method, which is a diet. You remove the food that you're allergic to. And if you're allergic to many foods, they'll put you on an elemental diet, which is where you just drink fluid. The fluid gives you all the nutrients that you need to live and survive instead of eating food. Now, they also treat the most common side effect, which is immune deficiency. They do this with immunotherapy. Immunotherapy is where you inject yourself with immunoglobulins using a pump like this and 2 to 4 needles like this. So one of the more important aspects of a disease is what it can be misdiagnosed as. EOE can be misdiagnosed as acid reflux because it shares the most common symptoms, which is dysphagia and heartburn. The Hospital of Philadelphia states that a doctor might prescribe an acid blocker like Prevacid or Prilosec, and if this doesn't work, then you should see a doctor about an eosinophilic disorder. So now we're going to move on to the second most common variation, which is eosinophilic gastritis, or EOG. This occurs about 1 every 2,000 people. Now the signs and symptoms from eoeresource.org, they state weight loss, diarrhea, bloody stools, loss of appetite, abdominal pain, vomiting and nausea, difficulty swallowing, and sensation of dysphagia and heartburn is common in many patients and can be more severe in others. Now, just like EOE, there are some treatment methods for EOG. The main one is a diet. Once again, they'll put you on elemental diets if you're allergic to many foods. However, EOG has a second treatment method, which is with steroids. The problem with this is that when you are done taking the steroid, the side effects will come back. And you can't take steroids for your whole entire life because it will cause problems. Now, the misdiagnosis of EOG is the same as EOE, which is acid reflux. Once again, the doctors might prescribe an acid blocker like Prevacid or Prilosec, and if this doesn't help you, you might have an eosinophilic disorder. So, eosinophilic disorders, as you can see, are very serious and are being identified in more and more people every year. Now that they're able to identify this disease in many people, they are being able to treat many people with this disorder. Now, just like myself, I'm under immunotherapy, and now I can live in the world with people.